Hi, good evening, and welcome to Golden Home Care Agency official Facebook page. Today, we would share and discuss on matters pertaining maternal health. We'd love to share and discuss concerning preconception care. My name is Austin Julius, and welcome. I'm a nurse midwife. Pregnancy is a special period in a woman's life. Why am I saying that pregnancy is a special period during a woman's life? It is special because the body requires a lot of adjustments. These adjustments are in form of physical, social, and physiological forms of adjustment. Therefore, just before a woman becomes pregnant, it needs to be prepared or psychologically prepared for these adjustments. A period between just before achieving a pregnancy is what we are calling the preconception period. And therefore, would want to share tonight about some aspects of care that a woman needs to achieve preconceptionally. Therefore, the preconception care that we are talking about tonight is a set of interventions that aims to identify and to modify the biomedical, behavioral, and social risks to a woman's health or pregnancy outcome through prevention and management. So what do we mean by all this? There are some certain steps that needs to be identified and modified just before a woman becomes pregnant or achieves a pregnancy so as to maximize health outcomes of the pregnancy that she has achieved. Therefore, these aspects of preconception care, we are going to classify them or rather categorize them under behavioral, medical, and social risks. And why are we saying that they are actually risks? It is because they can pose a danger to either the woman or the unborn child once this woman achieves the pregnancy. Therefore, under behavioral, you would appreciate that there are some forms of behavior or aspects of behavior that a woman could have been used to, or it could be living with them. Therefore, these forms of behavior or these aspects of behavior needs to be changed just before a woman achieves pregnancy. We shall discuss some forms of behavior that a woman needs to change or modify and live without before he achieves a pregnancy, such that once he achieves a pregnancy, he will continue through the pregnancy well, and these forms of behavior will not pose a danger to either the woman and the unborn child. And one of the behavioral aspects of our preconception care that we're going to speak about tonight is drug and substance abuse. You would appreciate that there are women, when they are not pregnant, they are used to a form of behavior that is used to taking drugs. And I will identify some of these drugs, and one of them is alcohol. Alcohol is a drug of abuse or a substance of abuse, and alcohol predisposes an individual, whether a woman or a man, to cardiac and hepatic diseases. And once a woman becomes pregnant and she continues taking alcohol, it predisposes to the unborn child to something we call fetal alcohol syndrome. Therefore, it poses a danger. And a woman who is used to taking alcohol is supposed to change this form of behavior before he achieves a pregnancy, such that once he achieves a pregnancy, he would have already adjusted and modified that form of behavior, because once he achieves a pregnancy and continues taking alcohol, it would pose a danger to the unborn child. Therefore, an individual or a woman, if he wants to achieve pregnancy and he is used to abusing alcohol or taking alcohol, he therefore needs to change. Another drug of abuse or something of substance abuse is smoking. When we look at cigarette smoking for a woman who is either pregnant or has not achieved pregnancy, would again pose a danger, either during the pregnancy period or to the growing fetus. Some of these dangers are, one of them is intrauterine growth restriction. If the woman is pregnant and continues taking alcohol, it predisposes herself to premature rupture of membranes, and therefore this is a danger because the pregnancy has not come to term. And a woman again who takes cigarettes or smokes cigarette predisposes a child to low birth weight. Therefore, it would give birth to a child that has got low birth weight, and therefore this is a risk to this child. Therefore, a woman who wishes to conceive or who wants to achieve a pregnancy would actually need to change this habit of smoking, such that once he achieves a pregnancy, he would not predispose the unborn child or a pregnancy to negative outcome. At times in families, domestic violence is a norm, or in some communities, it is a culture. Therefore, for a woman who has had an experience of such, or who experiences such, just before he achieves pregnancy, he needs to access the services of a counselor together with his partner so that they can discuss how this norm can actually be changed. Because we've had reported cases of women who have died while pregnant due to domestic violence. Therefore, if this is the norm or the culture in the community and a woman wants to achieve a pregnancy, he actually needs to visit a counselor together with the partner so that they can discuss this issue so that he actually carries out pregnancy. Because what we do not want to have a negative impact of this pregnancy because of the domestic violence. You would appreciate again that drugs are taken when a client or an individual becomes sick. And in pregnancy, they are not drugs, but they are some supplements which are actually, we can categorize them to drugs like folic acid. And these supplements, these drugs are actually important because they help the developing child, and they help to reduce fetal abnormalities, especially during the first trimester. Therefore, a woman who wants to achieve pregnancy is supposed to actually adjust to that norm of taking all these supplements throughout the pregnancy, such that will still prevent the negative outcome of this pregnancy, because we want to actually achieve a positive outcome. You would again appreciate the fact that drugs are taken while somebody is sick or when one falls sick. And it is a norm in our families, whenever we feel an headache or whenever we are unwell, instead of visiting the doctor or consulting with a medical practitioner, we rush to the chemistry nearby and buy some drugs, then we swallow. This is a norm. Sorry, the drugs that the over-counter drugs that are being taken may have a negative impact to the developing child or the pregnancy itself. Therefore, that norm of once somebody feels sick, that is a pregnant woman feels sick, and rushes to the nearby chemistry to buy a drug, needs actually to be changed. So it is something that actually needs to be discussed with a woman who wants to achieve pregnancy before becoming pregnant, such that that norm is avoided throughout the pregnancy period. Once a woman becomes sick or feels something like a headache, you should always consult a doctor and not buy over-the-counter drugs. There are women who have had a prior pregnancy loss. Therefore, if this woman wants to achieve another pregnancy, it is always advisable or good to seek the services of a gynecologist or a medical doctor so that the causes of the previous pregnancy loss can be investigated, because we do not want a case scenario whereby you've never been treated for the previous cause of the pregnancy loss, and again now once you achieve another pregnancy, it becomes a loss again. So these are some of the incidences that we want to avoid during the preconception care, such that we exactly know what actually caused the prior pregnancy loss, so that we can treat and we can investigate and treat before we achieve another pregnancy. There are also some psychological concerns that actually needs to be addressed before a woman becomes pregnant. Factors like unstable housing. If a woman is experiencing something like depression, if is under any other drug of abuse or substance of abuse, or stress because of one or two, three things in the family, those things needs to be addressed, or those psychological concerns needs to be addressed just before this woman achieves a pregnancy, because if they remain unresolved and he achieves a pregnancy, they might be a contributing factor to either her pregnancy loss or any other outcome towards a negative outcome towards this pregnancy. There are women with pre-existing medical condition. We call them comorbidities, like asthma, diabetes, hypertension, hypothyroidism, and these women are under treatment for such conditions. This treatment itself or the condition itself might have a negative impact on the pregnancy or the growing child. So if a woman is having a pre-existing medical condition, like the ones that we've just given examples, asthma, diabetes, hypertension, he should also seek the services of a gynecologist so that he can be advised accordingly, because we have said that this condition would actually contribute to a negative outcome, or their treatment bringing a negative outcome or affecting the developing child. Some of the treatment that she is on needs actually to be adjusted, others need to be changed until she delivers or she reaches at a certain gestation. Therefore, if a woman wants to achieve pregnancy, fails to acquire this aspect of preconception care, this might contribute to the negative outcome, which we do not want, a scenario we are not interested with, because we want to carry out our pregnancy to term. Something like obesity might not be a pre-existing medical condition, but you can have obesity or overweight. Therefore, weight reduction is again something of importance before attaining, because such can still have a negative impact on our pregnancy or the growing in the utero. There are some diseases or other conditions that are inborn in our families and can be actually passed from the mother to the baby. They are actually genetic conditions that can be passed to unborn baby. Something like we've heard of something like sickle cell anemia, maternal phenylketonuria, cystic fibrosis. We might not have a knowledge of the same as a woman who wants to achieve pregnancy. But when you seek the services of a medical doctor or a gynecologist, they would carry out the genetic preconception screening of genetic conditions. And once it's identified, it can always be sorted out, or you can be followed closely throughout the pregnancy, such that we do not have a case of a negative outcome of the pregnancy that you've already achieved. So it's always important to carry out preconception counseling as screening of genetic conditions that can be passed to unborn child, so that we carry out our pregnancy successfully, or you be managed successfully throughout the pregnancy period of these conditions. Sexually transmitted infections is also again something else that we need to be screened for just before we achieve a pregnancy. It is an aspect of preconception care that actually needs to be attended to. And whenever we're speaking about sexually transmitted infections, we are speaking of things like gonorrhea, HIV, syphilis, hepatitis B and C, things like chlamydia. And these infections form part of the investigations or tests that are carried out once a woman becomes pregnant. But just before you become pregnant, you actually need to be screened for them, so that in case you fall under any of these categories that I've mentioned of sexually transmitted infections, those that can be treated out successfully before you achieve a pregnancy. Those that cannot be totally cured, we have a way of managing them throughout the pregnancy to ensure that we do not affect the unborn child or the fetus that is growing in the utero, because all of them actually have harmful effects on pregnant women, their partners, and their fetus. In case you suffer from them during the course of pregnancy, they can again be treated to ensure that they do not affect our born baby. And it is again important for women of reproductive age to be asked about their sexually transmitted infection, counseled about the possibility of perinatal infection during pregnancy, and given access to treatment if needed preconceptionally and during pregnancy. The last form of preconception care that we need to look at is vaccination. And vaccinations, it is something that should be avoided during pregnancy period. and if given, conception should be delayed until the effects of these vaccines are over. So when you're speaking about this vaccination, you're speaking about vaccinations against cancer, the so-called the human papilloma virus vaccine, the influenza vaccine, the rubella vaccine, and things like varicella, because these vaccines, once given while you're pregnant, can actually pose a danger to our unborn baby. Or if you just given today and again you become like pregnant before 2 weeks are over, they can still pose a danger to the child that has already been conceived. Therefore, it is very important to identify the risks. We are calling them the social risks, the behavioral risks, and the medical risks just before conception, so that we maximize the health, so that we maximize the benefits, these benefits before we achieve our pregnancy. Thank you so much for listening, and that brings us to the end of the preconception care. Have a wonderful night. Thank you.